welcome you to the first episode of Bet You Don't Know,
where we talk about topics we bet you don't know.
And the title for today's video is
Bone.
and Bonus, where we say what the bones can't.
And today's topic is all about fractures.
Did you know that the word fracture came from the Latin word fractura, which means to break? In medicine, a fracture is defined as a break in the structural continuity of a bone. This can range from a small crack to a complete break into multiple pieces.
Fractures or broken bones are some of the most common injuries that can happen to anyone, regardless of age or lifestyle.
The type of fractures is categorized into four main types. First, whether the skin is broken or not, or what is medically known as open or closed fractures.
Another way to classify fractures is by completeness. A complete fracture occurs when the bone breaks all the way through. On the other hand, an incomplete fracture happens when the bone cracks but does not break all the way across, meaning the bone is still in one piece.
Another classification or category of a fracture is displacement. A displaced fracture means the broken ends of a bone have moved out of their normal alignment, while a non-displaced fracture indicates the bone is broken but the pieces remain aligned. Lastly, the direction of the break. Fracture directions are classified based on how the break occurs relative to the bone's long axis. Common classification includes transverse, oblique, spiral, and comminuted.
Let's talk about the symptoms of a fracture. These are the signs that help us know if a bone might be broken.
The first symptom is pain and swelling.
The second symptom is bruising or deformity.
And lastly, there is difficulty moving the part. In severe cases, the bone may even stick out.
But what are the main causes of fracture?
There are three major causes of fractures.
The first cause is trauma. This happens due to accidents, falls, sport injuries, or direct impact that puts too much force on the bone.
The second cause is osteoporosis or disease. Bones became weak and brittle, making them more likely to break even with minor stress.
The third cause is overuse or stress fractures. Repeated strain from activities like running or training can slowly cause small cracks in the bone.
A fracture can lead to several complications if not treated properly. Early complications include bleeding, nerve injury, infection, and compartment syndrome.
Fat embolism is also possible, especially in long bone fracture like femur. Late complication may involve delayed healing, malunion, non-union, avascular necrosis, or osteomyelitis.
These problems can affect mobility, function, and overall recovery of the patient.
Other complications include chronic pain, joint stiffness, and deep vein thrombosis.
Infection, especially in open fracture, pose a significant risk and need immediate treatment.
Nerve or blood vessel damage near the fracture site can also lead to long-term issues like chronic pain or impaired function.
Now, we'll proceed to the management of fractures. Take note that effective management is essential as it affects healing process, functional recovery, and long-term quality of life for the patients. Immobilization. If a fracture is mild and your bones did not move out of place, you might only need a splint or cast.
Secondly, close reduction is performed when a fracture is significantly displaced. It is a medical procedure used to realign a broken bone without surgically opening the skin. Bone fracture surgery is done when a broken bone cannot heal well with simple treatment. The common types are internal fixation, external fixation, intramedullary nailing, and bone grafting.
And for the last part, we will explain the 4 stages of bone fracture healing. First is hematoma formation. Blood clots form around the fracture to stop bleeding and start healing. Next, the fibrocartilaginous callus forms within 2 weeks. Growth factors trigger healing, new tissues and blood vessels develop, and stem cells create cartilage and bone to bridge the fracture. Third is bony callus formation.
Osteoblasts replace the soft callus with spongy bone, making it stronger.
And lastly, in remodeling, cartilage turns into bone as osteoclast breaks down old bone and osteoblast builds new bone, making it stronger and reshaped over time.
We have talked about the definitions, the types, the symptoms, the causes, the complications, and the management and healing process of the fractures.
And that's all we have for today.
See you next time for the next episode of
But you don't know.